concerned that they got an infection from an instrument or from our care. I remember seeing patients in literal tears because of the subpar quality of care they were receiving, and students also having panic attacks while on the shift because they were holding themselves responsible for the shortcomings of a profit-driven system that leaves so many people in our community without access to care and forces healthcare workers to choose between serving the privileged minority or working in under-resourced, subpar substitutes for insured healthcare. When I started medical school, I had so much anger and frustration with the idea of a student-run clinic being proposed as an adequate solution to people not having access to funded health care that I avoided my school student-run clinic like the plague. Instead, I put my efforts towards advocating for universal health care and the desegregation of care alongside countless other student organizers with Students for a National Health Program and New York City Against Segregated Health Care. Evan is one of those. He's right there. Okay. All right. Yeah. Despite not being involved in our student-run clinic at Sinai, my surgery rotation at Elmhurst Hospital, a New York City public hospital in Queens, that is criminally underfunded and primarily serves uninsured and Medicaid patients, again confronted me with grotesque scenes of malpractice and subpar care. The large majority of these instances were due to the hospital not having the capacity to care for the volume of patients currently cut out of our for-profit system, not because the providers were bad people. Physicians had 1 hour to see 50-plus patients during morning rounds. I can still remember my preceptor pulling me aside to reprimand me because I could not bear to leave the bedside of a patient who suffered multiple crush injuries after being run over by a truck. She was mad at me that I didn't leave her and cut him off after he couldn't even get 2 full questions out. And she was upset because us leaving him, us staying would have meant leaving other people with like no capacity to see the team at all. The disaster that is the care uninsured patients receive, if they receive any care at all, is a crime. It results in death and disability. And as someone who went into healthcare to be a healer, it is unbearable to watch and do nothing about. We must call for healthcare for all and the abolition of our for-profit healthcare system. It can and will start here in New York and reverberate across all 50 states. Medicare for all!
Medicare for all! Medicare for all!
Stand up, fight back!
Medicaid is under attack! What do we do?
Stand up, fight back!
What do we do?
Stand up, fight back!
What do we do?
Stand up, fight back!
Our next speaker is Dr. Shakira Kennedy with the National Association of Social Workers, the New York chapter.
Good morning, everyone. I appreciate everyone coming out to support the birthday of Medicaid and Medicare. To shine a light on this issue. You've heard the stats. There will be $1 trillion cut from Medicaid and Medicare. What does that mean to New Yorkers? Over 2 million New Yorkers will lose Medicare and Medicaid just this year. That is a problem. Every day, social workers, physicians, nurses, behavioral health professionals, and our first responders witness impossible choices too many individuals and families have to face. They delay seeing their doctor because they cannot afford the copay. They ration medication to make it last over a month. They ignore symptoms until preventable illness becomes a medical emergency. These are not failures of an individual. They're the failures of the system that too often the access to health care, employment, and income or circumstances has not been afforded.
That's right.
Health care should never be determined by your zip code,
Yes.
your employer,
Exactly. Yes.
or the balance in your bank account.
Yes.
It is a basic human need and should be treated as a fundamental human right.
Yes.
In the words of my favorite entertainer, Cardi B, if legislators do not act, we need to give them the belt. And the belt is the voting ballots. Go your right to vote and vote them out. Thank you.
And next we're going to have from Make the Road, Nilda B. from Make the Road.
Hola, hola. Hola, hola, buenos días. Buenos días. Mi nombre es Nilda Baez, soy líder de Trabajador en Acción de Se Hace Camino Nueva York. Como comunitaria de Medicare, New York, hoy estoy aquí para exigir que Nueva York amplíe el acceso a la atención médica mediante la aprobación de la Ley Salud de Nueva York y Medicaid para todos. En su 61 aniversario, Medicare y Medicare. Como líder comunitaria, recibo muchas llamadas de mis amigos y mis amigas y de mi comunidad que están pasando muchas dificultades. Justo ayer me llamó una amiga con cáncer y le cortaron los servicios y otras amigas más, no solo ella. En mi comunidad está sucediendo eso en estos momentos. Le habían cancelado los servicios de SNAP y otros servicios. Ella necesita más apoyo. No le quiten esos beneficios vitales. Estoy en proceso de renovar mi Medicaid y me indigna saber que el próximo año tendremos que renovarlo 2 veces al año y que quizás tengamos que proporcionar aún más información y demostrar que merecemos, que tengamos que proporcionar aún más información, demostrar que merecemos atención médica. Estas son barreras burocráticas innecesarias que harán que más personas pierdan su cobertura médica, harán que pierdan todos otros servicios que son necesarios, porque ellos creen que no somos elegibles, sino porque el sistema dificulta mantenerla. Sabemos que esta es la intención de esta administración. Como persona mayor que vive con un ingreso fijo, no puedo permitir perder mi Medicaid. Vivo con enfermedades crónicas como diabetes, problemas del corazón y otros problemas de salud que requieren atenciones médicas constantes. Necesito citas médicas regulares para mantenerme sana. Nuestras comunidades necesitan más atención, apoyo de todos ustedes, no más obstáculos. Los neoyorquinos se enfrentan al aumento del costo de la vida, a los desalojos, a la crisis de salud mental y a la separación familiar. En lugar de dificultar la vida, nuestros líderes deberían garantizar que todos tengamos acceso a la atención médica y las necesidades básicas. La atención médica es un derecho fundamental, es un derecho humano. Necesitamos que nuestros líderes neoyorquinos abran el camino aprobando la ley de salud para todos en Nueva York y luchando por un sistema de salud universal. Medicare para todos. Medicare para todos. Para que cada uno pueda vivir con salud y dignidad. Medicaid es un derecho fundamental. Sí se puede. Sí se puede. Sí se puede. Muchas gracias. Buenas tardes.
Hi everybody, my name is Luisa and I'm going to be interpreting Nilda's testimony. Good morning everyone, my name is Nilda and I'm a community leader with Make the Road New York. I'm here today to demand that New York expand access to health care by passing the New York Health Act and Medicare for All. As a community leader, I received many calls from community members who are struggling. Just yesterday, I received a friend who called about cancer. She told me her SNAP benefits had been terminated. She needs more support, not less, not these lifeline benefits being taken away. I'm in the process of renewing my Medicaid and knowing that next year We may need to renew Medicaid 2 times a year and may need to provide even more information to prove that we are worthy of health care makes me angry. These are unnecessary bureaucratic barriers that will cause more people to lose their health care, not because they are knowledgeable, but because the system makes it difficult for them to keep their coverage. We know that this is the intention of this administration. As a senior living on fixed income, I cannot afford to lose my Medicaid. I live with chronic health conditions, including diabetes, heart disease, and others that require ongoing medical care. I need regular doctor's appointments to keep myself healthy. Our communities need more care and more support, not more obstacles. New Yorkers are struggling with the rising cost of living, facing evictions, experiencing mental health crises, and being torn apart by family separation. Instead of making life harder, our leaders should be ensuring that everyone has access to health care and basic necessities. Health care is a human right. We need our New York leaders to pave the way by passing the New York Health Act and for fighting for Medicare for all so that all New Yorkers can live life with dignity and justice. Sí se puede.
Sí se puede. Sí se puede. Sí se puede. Sí se puede.
Thank you. So we've heard from many different people who are affected by all of these changes, but we also are very, very lucky to have our state senator who covers east of Manhattan, Queens, northern Brooklyn. I don't know how you do it. And I'm her constituent. So, bringing to you Senator Kristen Gonzalez.
Human right. Fight, fight, fight. Healthcare is a human right. Fight, fight, fight. Healthcare is a human right. Fight, fight, fight.
Thank you all so much for being here. How are we feeling today? It is really an honor. My name is Kristen Gonzalez. I am the state senator in this district. I represent Bellevue Hospital that we are standing in front of. Shout out to Bellevue. Bellevue is a public hospital. Bellevue doesn't turn people away. It takes people with all types of coverage. And it sets a standard that when we fund our public institutions, we can get real people care. Yes. And that's important because I think our government has forgotten who it serves. Right. It should not be a radical idea that as legislators, we should believe that each and every one of our constituents deserves to live, deserves to have health care, deserves not to go bankrupt simply because their health bills are too high. Yes. It should not be radical or controversial that we pass bills like the New York Health Act, that we fund the 450,000 New Yorkers that have lost their health care, or that we continue to fund our public institutions. And yet, what we have seen from President Trump and our federal administration is the exact opposite. We have seen a fascist administration that is more interested in funding bombs than funding the people who live in this country. We have a federal administration that somehow has the money, the billions of dollars to fund rogue ICE agents to kill our neighbors on the street, but not pay for cancer treatment? A federal administration that has just cut over $900 billion from Medicaid. We need elected leaders to start doing their jobs, to start serving the people that elect them right here in this country. And if we have a federal government that is nothing but fascism and failure, we need a New York State legislator that is willing to step up. And so as a state senator, I find this incredibly important in this moment because it does not have to be this way. We can, as New York State, find the money to actually fund our healthcare system, to have a single-payer health system. And to all of my colleagues who say that they want this and have stood with us, I want to say thank you. But to anyone across the aisle who has yet to join this fight, I invite them in this moment because every day we fail to stand up for healthcare as a human right. We are fundamentally failing New Yorkers.
Yeah.
So I want to say thank you to all of the organizers here today who have taken their time to stand up for millions of New Yorkers who simply cannot make it today, who may be home trying to figure out how they're going to afford rent, how they're going to afford food, how they're going to afford their health care or child care or any number of things that make this state unaffordable. You are representing the majority. We are on the right side of history. And at this moment, I truly believe that we can do the right thing and in the next legislative session actually pass the bills that will provide health care for everyone. Thank you all so much for being here. Thank you for showing up, and I'm so proud to stand with you in my district. Thank you.
Thank you, New York Health Act.
That's right.
New York Health Act.
New York Health Act.
New York Health Act.
New York Health Act. New York Health Act. New York Health Act.
Thank you, Senator. Thank you for your words. Okay, so the next thing the next person we're gonna hear from is from the Nurses Association. Alicia McMyers, the nurse at Harlem Hospital and member of NYC Board of Directors.
Thank you. Good morning.
Good morning.
My name is Alicia McMyers. I've been a registered nurse for over 3 decades. And I became a nurse because of my grandfather, who had a love to take care of people. And we both have worked for the largest health care system in these United States, health and hospitals. Yes. So it's great to be surrounded by other healthcare advocates who understand that healthcare is a human right. Yes. Yes, we are here to celebrate the anniversary of Medicare and Medicaid, and also to advocate to fully fund and extend these life-saving programs. It's hard to imagine what our healthcare system was like before these essential public programs were created. Well, I do, because I remember my grandparents talking about what it was like to seek healthcare before they had Medicare. In the 90s, after I became a nurse, fresh out of school, my mother, who worked all her life and had lost her job, suffering from cancer, had to rely on Medicaid. I know you all have personal stories. Approximately half of this country was uninsured. So our seniors, our babies, expectant parents, and especially people with disabilities, we had millions of people who lacked access to quality care, affordable health care, and who suffered and died prematurely because of it. And as a nurse now as a care manager, taking care of people with complex conditions, I still see people suffer because of the lack of access to health care, especially with these cuts.
Some cuts don't heal.
That's right. So as nurses, as people, as healthcare workers, we see it every day. People are falling through the cracks. They're deciding whether they're going to eat, deciding if they're going to pay their rent. And with these latest cuts, don't ask them about their medications because it's not going to happen. We have a federal administration that has made those cracks much larger and easier to fall through. As a result, patients delay care or they forego it altogether. Volumes in the hospitals, any organization, is decreasing. We have a federal administration that is cutting hospital funding and cutting quality care. The cruel agenda is being carried out to give tax breaks to the millionaires and the billionaires. Boo! Shame! They don't need it. But as we come together and as we fight back, we don't want to go back to the days before Medicare and Medicaid.
Hell no.
No.
We need to help people live longer and healthier lives. We have the resources to do so. These programs were created once, but we can and must strengthen and build upon them now. We need long-term sustainable solutions like the New York Health Act and Medicare for all. We must end the cruelty of this administration and healthcare system that allows people to fall through the cracks. We have to show that we care for all New Yorkers, not just the wealthy VIPs, because every person
is a VIP.
Every person is a VIP. We have to join the ranks of the other nations in the world that have some form of universal single-payer healthcare. It works. And we have, above all, to guarantee that healthcare is a human right. 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 Because every patient's a VIP. Thank you.
When healthcare is under attack, what do we do?
Stand up, fight back.
When our hospitals are under attack, what do we do?
Stand up, fight back.
When New Yorkers are under attack, what do we do?
Stand up, fight back.
What do we do?
Stand up, fight back.
What do we do?
Stand up, fight back.
I want to remind everyone that Medicare was a promise. It was made as a promise that all of those people who were destitute after they finished working and had no incomes, we made it and we contribute. This is not a handout. This is something that we contribute every single working day of our lives. So at the time now that we're able to collect it, they want to change the rules. But the rules that we need changed are that they strengthen Medicare and make it more so that our children and grandchildren are able to access it. All right, the next person is Alfredo Lopez from Radical Elders.
I gotta speak from here.
Oh, no, you need a mic. You need a mic.
I'm sorry. I'm Alfredo Lopez, National Coordinator of Radical Elders. I'm here with Angel Roman, Ana Huerbe, who are members of Radical Elders. There's some of our members there among you. They can introduce themselves to you. Today we celebrate. Today we celebrate a critical first step in the recognition of healthcare as a human right. Our movements, the people who made this happen, must continue the fight to protect what's been created, which is now under threat, and expand it to what it should be, which is healthcare that's accessible to all, always for free. As elders, we fight for a full life that's productive and safe. That's our right.
Yes.
And it's the key to the singular contribution we can make to the entire society. But it's only possible with free, quality health care. So let this birthday be a day of commitment to finishing the job we began 61 years ago. Pass the New York Health Care Act, Medicare for all, free health care for everyone. Okay, now I'm going to say it in Spanish for those.
En español.
En español. Soy Alfredo López, coordinador nacional de la Organización Mayores Radicales. Hoy celebramos un primer paso fundamental en el reconocimiento del cuidado de salud como derecho humano. Nuestros movimientos, lo que han hecho posible, deben continuar esta lucha para proteger lo que se ha conseguido, que ahora está amenazado, y ampliarlo a lo que debiera ser, un cuidado de salud accesible para todos, en todo momento y gratis. Como mayores, luchamos por una vida plena, productiva y segura. Es nuestro derecho y la clave de lo que podemos aportar a toda esta sociedad. Esto solo es posible con un cuidado de salud gratuito y de calidad. Que este aniversario sea un día de compromiso para terminar la labor que comenzamos hace 61 años. Aprobar la ley de salud de Nueva York, Medicare y cuidado de salud para todos. Gracias.
Muchas gracias.
¡Sí se puede! ¡Sí se puede! ¡Sí se puede! ¡Sí se puede!
And from the Board of Directors of New York Statewide Senior Action Council, Mario Henry.
Can you hear me? Yes! My name is Mario Catano Henry, from New York Statewide Senior Action Council. I'm a senior citizen. My mother was crippled for 40 years, bedridden for 14, 11 at home, 3 in a nursing home. Medicaid, Medicare, and Social Security made it possible for me to care for her. It wasn't easy. I'd rather be dead than go through that again. But it made it possible to care for her and for me to go on working. Today, I'm a senior citizen, retired, and I'm on Medicare. I've had 2 hernia operations. I've been treated for prostate cancer. I got glaucoma and high blood pressure. And I'm also a little crazy, but that's something else. Medicare pays for that. If it wasn't for that, I'd definitely be broke, probably dead. Medicare, Medicaid, and Social Security are the bare minimums that a civilized society does for its people. Less than that, the government loses legitimacy. Instead of spending hundreds of billions of bucks bombing all over the world, that money should be spent here. Yeah. We have the most expensive healthcare system on the planet. Twice as expensive as the next most expensive system. And yet we do not have the highest life expectancy. Many countries have a higher life expectancy. Many countries have a lower infant mortality rate. And many, many countries have a lower maternal mortality rate. We can do better. We will do better.
Yes, we will.
We will fight. We'll fight today and tomorrow. We will never stop fighting. Thank you.
All right.
When do we want it?
Now! Is Councilmember Christopher Marta here? Okay, so now we have an uplifting presenter. I give to you Peppermint. Where's Peppermint? All right, Peppermint.
Hello, everybody. My name is Peppermint. Good morning. Thank you to all the healthcare workers and nurses and professionals that are here. I am a drag entertainer and performer and actor in New York City. Been here most of my life. And for most of that time, I've been a freelance gig worker, which meant I've been in and out of money and poor most of the time. And for 10 years living here in New York City, I did not have any health care. I didn't even go to the doctor for about 10 years, a little more than 10 years of my life here in New York City. And I was basically neglecting my mental and physical health. And it wasn't until I was desperate enough to begin my journey as a trans person and seek gender-affirming care that I was able to, thanks to a mandate of healthcare having to cover gender-related services. That's when I finally went to the doctor for the first time, 10 years later. And among other health issues, I was able to start my journey. And it's really important that people understand in this message, amongst all of the attacks on the trans community, that people know that gender-affirming care is health care.
Right.
And that every single person who's trans, who receives gender-affirming care, is treated by healthcare professionals who use the same exact knowledge and information and expertise in the healthcare field that they use to treat everybody else who isn't trans. That's really important for people to know. I sought gender-affirming care not to become somebody new, but to match who I already am. And gender-affirming care can be life-saving. And for me, the need for gender-affirming care felt life or death because it was. So after 10 years of no doctor, suddenly healthcare became a red line for me. It was non-negotiable. I was desperate, and I would have gone anywhere and done anything in order to get it, and many trans people do. So today we still have trans people that struggle to get the same services that many other people who are cisgender or not trans can access with not much trouble. And it's so wild to see that trans military bans are happening because trans people are trying to access hormones in the military, then to turn around and see a campaign by our military to give hormones to the military after banning trans people. So when people are happy and healthy, they can function in a society that asks or even demands of them to serve and fight and work for a living and pay taxes and even go shopping. So why does healthcare need to be a last resort for so many people? Why does healthcare have to be life or death? It's because corporations have teamed up with every political party to create a barrier between most people and what every single human needs, which is health. Now corporations and elected officials can make money off of your desperation. And there seems to be no end to the amount of money that they want to make. So they use AI to determine whether or not a person deserves health care. I lived in NYC most of my life, and for the past 6 months, we've seen that things can be better and government can work for the people regardless of how much money they have, regardless of their identity. Being trans should not be a reason to exclude people from health care. It should be a reason, yet another reason, why we all see that we all deserve it. Everybody should be able to get what they need from health care, and there's more than enough to go around. We can see that because our elected officials have voted to steal money from our pockets that was already paying for health care to send money overseas and bomb people and provide tax breaks to billionaires. And the same corporations and CEOs that pollute the environment, hoard resources and pump chemicals into our food and turn around and charge us more money for the food that's making us sick in the first place. In a country with the highest levels of heart disease, we are just a couple of years out of a pandemic. And in the richest country in the history of the world, we are in the middle of a psychoslora outbreak, which I've never even heard of, and some other damn outbreak that's affecting the beef, and people are sick and shitting themselves because they can't even get medical coverage, yet medical debt is the #1 reason why most people go bankrupt in this country to begin with. Healthcare is a human right, and there's been a lot of things and a lot of reasons to distract us over the past, I don't know, dozen, 10, 20, 30 years. But now that life has become so much more shitty in this country that is so expensive and more costly and more dangerous for the average person, we want what we deserve, which is our health care and the ability to be healthy and happy. And our elected officials, you've been playing games, and I hope you took pictures with your partnerships with all these insurance companies and corporations, because that time is over. We are coming for what we want, and we will get it, and we will. If you're standing in the way, you better watch out, because you will be out of a job. You were sent there by us to represent us, and if you haven't been doing that, you better take pictures, because the time is up. I hope you enjoyed your time, because we are putting people in office who will make laws to make sure that people like you can never serve again. Healthcare is what we have been paying for. It is what we will take. It is our right. Healthcare has nothing to do with the system. Healthcare belongs everywhere that a human being is, and we are human. Thank you.
Fight, fight, fight. Healthcare is a human right. Fight, fight, fight. Healthcare is a human right. Fight, fight, fight.
Healthcare is a human right. Fight, fight, fight. Okay, so in conclusion, we are here to say that Medicare was a promise, right, made to make sure that nobody in their elder years or people who need help go without health care, or that would have to bankrupt themselves to get a basic human right. The other thing is that as we age, New York City has more people 65 and over than younger people. So it's a reality that Medicare needs to be strengthened and passed down to everybody, all of the generations, which is why we also want the New York Health Act.
Yes!
sure you reach out to your elected officials. Remember that the elections are in November and that we need to make this one count. All right, have a great day, everyone.
Can we get one photo before folks head out? If you can gather around, kind of cluster in. Love to get a group photo all together.
Nice job with that mic, man. I was so jealous. What did I think of that?
And kind of fill in behind, maybe, and hold your signs up high. Or low, depending on where you are in the crowd.
Okay.
Everybody signs up. Everybody say single payer.
Single payer.
Medicare for all.
Medicare for all.
Healthcare is a human right.
Healthcare is a human right.
Not just for the rich and white.
Not just for the rich and white.
All right, thank you all.
¡Se puede! ¡Sí se puede!
Sí se
¡El
puede.
pueblo unido jamás será vencido! ¡El pueblo unido jamás será vencido! ¡El pueblo unido jamás será vencido!
The people united will never be defeated. The people united will never be defeated. The people united will never be defeated.
Please return over here.
Con la carta, con la carta.
Okay, cool.
All right. Probably not. But we'll see.
Medicare for all. Love it. Thank you so much. Yeah, if you can. Okay,
No se ven todos. Hold on. I need to step back. Thank you. Okay. Aquí. 1, 2 fotos, 3. Y ahora un video. Sí se puede, ¿ok? 1, 2, 3.
¡Sí se puede! ¡Sí se puede! ¡Sí se puede! ¡Sí se puede! ¡Sí se
Queremos cobertura médica. ¿Ok? ¿Qué queremos? Cobertura médica. ¿Qué queremos?
¡Cobertura médica!
¿Qué queremos?
¡Cobertura médica!
¿Y cuándo?
¡Ahora!
¿Y cuándo?
¡Ahora!
¿Y cómo?
¡Luchando! ¡Creando poder popular!
Luchando.
¡Creando poder popular!
¿Qué hacen que no la conocer?
Ahora tú, Luisa.
Thank you so much.
Thank you.